Hi, my name is Dr. Odoyo Edward of Kisumu Dental Centre. I'm a dental surgeon, and today we are partnering with Ponea Health, and we are speaking about tooth cavities. Some of the red flags that will let you know that you need to visit the hospital if you have a tooth cavity is when you start developing sensitivity, which means your tooth hurts when you take something cold or something hot. If you have pain, or if you have a visible cavity on the tooth, a visible hole, if you have discoloration of the tooth, your tooth certainly changes color, then you know it's time to visit your dentist. Okay, so some of the treatments that you could be used to address tooth cavity are one, if you have pain, you can take medicines commonly known as painkillers. Then you need to visit the dentist. Now the dentist will be able to, after examination, recommend some treatment for your tooth. Commonly, cavities need to be filled. Depending on how extensive the cavity has progressed into the tooth, there may be additional treatment that the dentist may recommend. For example, doing root canal treatment on the tooth, or covering it with some crown, or other forms of restorations. Depending on how extensively the tooth is damaged, your dentist may require to do some procedure called root canal treatment on your tooth, or to put some more complex restorations like crowns or veneers to repair your cavity. Okay, so your tooth cavity might put you at risk of other health complications. For example, as we said, this is the bacteria which are responsible for this kind of disease. And this bacteria could get into other tissues like your bone, into the bloodstream, and into the other distant organs. It can cause damage to your heart valves or other valves within the blood vessels, or lead to generalized body infection. Okay, so if you have a loved one with tooth cavities, what you need to support them with is to give them advice on how to take care of their teeth, which is by brushing the teeth at least twice in a day, in the morning after their breakfast and at night before going to bed. Then you may want to encourage them to visit a dentist to have it checked out. You may need to get them some medicines to relieve pain if they're in pain before they get to the dentist. We have largely talked about tooth cavities in the sense of tooth decay caused by bacteria breaking down acids, breaking down food substrate in the mouth to produce acids. There are other cavities which might form on your teeth, which are different from this, and these would be cavities due to wear and tear of the tooth rubbing against each other, what we call attrition, or it might be because of your teeth wearing away and developing holes as a result of wear and tear from other substances. For example, if you brush your teeth aggressively, then you may have some what we call abrasion cavities. Now, all in all, the way they would affect the tooth is similar to what we have explained earlier, and the remedies would be similar. Thank you for viewing this episode, and we invite you to join us again and check out our next episode. You can access our services by booking on ponea.com.